Hi, everyone. Welcome to Advanced Pathophysiology, Chapter 47, Alterations in Integumentary or Skin. And I am Dr. Shields. So let's just talk with the types of skin lesions. There's two main categories of skin lesions, and they are primary lesions or secondary lesions. So pretty simple. A primary lesion develops just directly as a result of a disease process, like maybe a blister occurs because somebody has chicken pox, or maybe a mole or a freckle. That's something primary. And then a secondary lesion develop because they evolve from a primary lesion. So maybe scratching and it causes a mole to bleed. So the primary lesion extends itself or progresses. And once the mole gets scratched and it bleeds, it turns into a crust or a scale. So that would be considered a secondary. So it's pretty simple. Don't get too wrapped up in it, but they are categorized in two different categories. Okay, so some different types of skin lesions, and I'm just going to go over a few here that I want you to know, and you don't have to memorize all this. So they're just different lesions are referred to different names, just kind of based on their characteristics. The first is a cyst right here. It's an encapsulated mass of dermis or subcutaneous layer, solid or fluid filled right here. So like a pimple could be a cyst. It's filled with, fluid or a pus, maybe. A fissure is a break or split in the tissue, usually at the junction of skin and mucous membrane. So it's just like a crack right here, a small tear in the lining. And the most common example is an anal fissure in the anus. And what happens is there's a small tear in the lining of the anus. A macule is flat, so that's something I want you to circle. A macule is flat, circumscribed, so there is a boundary. They're typically discolored lesions and they're small. Like a freckle is an example of that. Or you can see like a flat mole. Or sometimes little babies get like what we call port wine stains or stork bites, like a little birthmark maybe. Those would be considered macules. They're flat and discolored. A nodule is a palpable lesion in the epidermis, dermis, or subcutaneous layer. So it does kind of go deep here. Can be a little bigger. Nodules are bigger, 5 milliliters to 2 centimeters. You don't need to memorize these sizes. It just kind of gives you an idea. Like a fibroma would be an example, a xanthoma, a nevi, which we'll talk about. We'll talk about that. So they're a little bit bigger and they're kind of filled with something. A papule is raised. It is a lesion which is kind of small, 1 centimeter or less, a small, solid, raised bump on the skin that has a border with edges and easy to see. Papules could be red, purple, brown, or pink, caused by infiltration or hyperplasia of the dermis. And these are just like raised pimples. Like another thing, like these are like you have like kind of raised pimples, like a rash. Papules usually form, there's a lot of them, little raised bumps on the skin, and it gives the appearance of a rash. A polyp is an abnormal growth of tissue projecting from a mucous membrane. It's attached to the surface by a narrow, elongated stalk right here. And polyps in the colon and the uterus are common. So it's just an abnormal growth kind of hanging on there by a stem. Consider that a polyp. The next one, a vesicle or a bulla, fluid-filled, thin walls lesions. Generally, it's like, examples here, herpes, impetigo, like a blister. So they're filled with fluid, but they're thin, like you get a sunburn or you get a burn and it starts to blister with fluid underneath it. And that's a vesicle. And then a pustule, I don't have written over here. I just kind of noticed what pustule is like. A pustule is kind of like a nodule, but it's filled with pus. Okay, it's not filled with um, maybe like cholesterol, like a xanthoma or fibrous tissue. It's filled with pus. And the last one, a wheal, a transient lesion with well-defined changing borders, edema in the epidermis. So it's swelling under the first layer of skin. They could be really big. And a perfect example of a wheal is when you get a hive or you get a mosquito bite and you get that big red, well-defined kind of edema, big blob of edema underneath your skin. Or when you get a TB shot and they put it under your skin and it forms a wheal. Okay, let's move into diseases and conditions, and we'll start with some inflammatory type of skin conditions. The first one being dermatitis, and we'll talk about two different types: atopic dermatitis, and another name for this is eczema. It's the most common skin inflammatory disorder, and it generally denotes a form of allergy with a hypersensitivity reaction. So they have a hypersensitivity type of reaction, and a dermatitis might occur. Atopy or asthma might occur. So something that is from an allergy. And here's a picture of normal skin, and here's a picture of atopic dermatitis or eczema. And you can see how this is just fluid filled, see between the cells, and red. It's just inflammation. Atopic dermatitis or eczema can be a chronic, long-lasting disease that can cause inflammation, redness, and irritation of the skin. It's a common condition that usually begins in childhood, and then sometimes people have it the rest of their lives. Or, however, anyone can get this at any time. And you can kind of see right here how it's just this raised, red, inflamed, and it's itchy. The second one here, the seborrheic dermatitis, the rash usually develops on the scalp, and this is an example of seborrheic dermatitis here and on this person's eyebrow. And seborrheic means it's excessive discharge from a sebaceous gland or from sebum, and usually we have a lot of sebaceous glands in our face. Very common, and again, it's most commonly affects the scalp or somewhere on the nose where there's kind of oily type of sebaceous glands on the face, and it causes these scaly type of patches over this inflamed skin. It can appear as like a really stubborn dandruff, and again, mostly in oily spots on the skin. The next one is rosacea, a common skin condition that causes blushing or flushing and visible blood vessels in the face. You can kind of see the blood vessels in her face here. It may also produce small pus-filled bumps. These signs and symptoms may flare up for weeks or months, and then maybe they go away for a while. And it can be mistaken for acne and other skin problems, or it might just look like somebody has ruddiness, which is a red face. So it's really a long-term inflammatory condition, and it most commonly affects the face, very commonly affects the nose, like in this gentleman right here. If it gets too close to the eyes, it can cause some eye problems. And generally, sun exposure or high stress situations may cause this rosacea to kind of manifest or exacerbate. The next disease or skin condition I want to talk about next is psoriasis. And psoriasis is patchy and thick red silvery scales on the skin. So these are raised. This is hypertrophy. These are skin cells that are hypertrophied. And they're characterized by these kind of crusty scales. And you can see this is the skin layer right here. And then this is scales, inflamed scales, and this hard kind of plaque that forms. Patches are typically found on the elbows, knees, scalp, and trunk. Could be anywhere, but those are common. The most common type of psoriasis is called plaque psoriasis because look at this big high raised silvery red plaque. It's common. It's long term. It's a chronic disease. There really is no cure, but there are quite a few medications that are available to treat it. It can be very painful, especially in the flare-ups. And one thing I don't have written here, you go ahead and write down, is there's a type of arthritis that's called psoriatic arthritis. So it's arthritis with psoriasis. And it's a type of arthritis that's actually linked with psoriasis. So they have arthritis and psoriasis. And again, they have joint issues that are consistent with arthritis. Plus, they have the skin condition, which is this silvery red scales that they exhibit. And again, both of them are treatable. This one right here, this next one is called erythema. So remember, erythema is red. That means red. Migrans, which migrans is like migrating or moving. And it's a rash that frequently appears as one of the first symptoms of Lyme's disease. And I just wanted to bring this up because it's a specific type of rash that occurs. And it's called erythema migrans, or it's typically a circular red area that sometimes clears in the middle like this. See how it kind of clears up? And it looks like a bullseye pattern. And it's migrans, it migrates. This red line, this bullseye can get bigger and bigger in a bigger area. It can spread up to 12 inches across and maybe warm to touch. So this bullseye rash, or this erythema migrans, is a common sign of somebody who has Lyme's disease and they got a deer tick bite.
We have urticaria or hives, type 1 hypersensitivity reaction to...
What? Sorry, that was weird. So this is urticaria or hives, and it is a type 1 hypersensitivity reaction to allergens. So somebody eats something and they become allergic to it. It's a histamine release, endothelial cells of the skin to contract. It causes leakage of fluid from the vessels, and so they get these fluid-filled vesicles on their skins. And any type of allergic reaction that causes hives, we can treat them with antihistamines and steroids. Okay, that's the end of part 1.